the more traditional forms of treatment, typically the side effect profile of them is very, very bad. Do you notice with doing these treatments that there's any side effects with it or, pain associated with doing them, or are you able to avoid those?
So, side effects in the medium to long term, almost none. There are risks, like with any injection, whether it's an intramuscular injection or a joint injection, infection. Obviously, have protocols to mitigate that. Nerve irritation, nerve trauma, ways to avoid that, but it's never 100%. But I've never had anyone injured more from doing a regenerative injection therapy. There may be short-term issues like nerve irritation sometimes can last a few weeks, but that's incredibly rare. Most of the time, it's what we expect. It's for really 1 to 5 days post-injection. There's going to be more aches, more pain, and that's actually sort of paradoxically what we want because we're upregulating inflammation in the body so that the body activates the healing response. So it's not a treatment where you go in and we do the injection and, the next day, poof, pain-free. I'd say the only time I see that is with medicinal signaling cell when we're using the big guns, the actual growth factors that are neonatal derived. I have been able to see that the next day. Like I have a testimonial on my website from a former pro football player. And he said, as the next day, he decided to go out for a walk and then just decided to go for a jog. Like it was life-changing. But I would say the majority are not that. The majority do go through several days of achiness. I wouldn't say it's not debilitating pain, but it's like, you sprain your ankle and it's going to be swollen and inflamed and achy. With regenerative injection therapies, that's usually what we want because we need that inflammation to create that healing. Other than that, there's really not the kind of side effect profile because what we're injecting is short-term anesthetic just to help with the pain of the actual injections. So it lasts for 1 to 4 hours. So there's no long-term pain medication that is part of this. And then everything else is inflammatory solution like dextrose or oxygenating and antimicrobial like ozone or platelet-rich plasma that has growth factors derived from the patient's own blood or, growth factors that are derived from neonatal cells. So there's no medication that's going to potentially create side effects, like with steroids that have been well known to cause tendon ruptures, well known to cause weight gain, cause hormonal disruption, cause immune system issues. And at the end of the day, if they're helpful for a period of time, which can be a matter of days, weeks, months. The only time that I ever see a steroid injection as helpful is if it's an inflammatory issue like a bursitis that we just need to get the inflammation down to reduce the pain. But even with that, I'll use micro dosing. We don't need to use these high doses of steroids in those sort of conditions. For most people in chronic pain, I try to avoid steroids as much as possible because it leads to weaker ligaments, and ligaments are what stabilize bone to bone. So whether it's a knee or a vertebrae in the back or a bone in your wrist, like we need those ligaments to be strong and keep those bones in place so that the muscles and the tendons don't take over that stabilizing role and then get tight and irritated and actually cause pain. So really ligament laxity is a huge issue that's not very well spoken about or addressed in the world of chronic pain, but it's a big issue. And it's something that if you get an image, like you get an MRI of your back, it's not going to show you if your ligaments are weak or lax. It's only going to show you if there's a tear, swelling, something like that. So the laxity can be a really big problem because the muscles tighten up and that's where the nerves are, and that can create more pain.